What's up, guys? Justin Morgan here, Carved Up Vegan Muscle, and there has been a lot of talk lately between vegans and Furious Pete, who has cancer, and Jason Blaha and Vegan Gains, and all kinds of big names in the YouTube fitness scene have gotten involved, saying all kinds of crazy things. And I got my attention came to this because John Keating from Vegan Health and Fitness made a video here recently, and he was just discussing some of the things that Jason Blaha had claimed. And what really caught my interest was Jason's claim that many dietitians have used ketogenic diets as a way to treat disease and to reverse cancer and different types of things, or something like that. I'll play it for you here.
And why are ketogenic diets used by some actual physicians and have been found in research and data and physicians and registered dietitians to be useful for treating many types of cancer?
So, as you can see from Jason's claims, you would think, like, wow, really? Like, there must be like this weird dichotomy of things. What are dietitians actually recommending? And as someone who actually has a degree in dietetics, instead of just pretending to have one on YouTube like so many people do, I actually want to go back and look at my nutrition book here from this is a book that is approved by the Academy of Nutrition and Dietetics as part of a curriculum that is also approved by the Academy of Nutrition and Dietetics for the use of medical nutrition therapy. Now, you cannot just go to any college and get a degree in dietetics. It has to be a school that's program is approved by the Academy of Nutrition and Dietetics, formerly known as the American Dietetics Association. And many colleges have like nutrition things, and you can learn about nutrition, but that doesn't mean that you're qualified to give at least, on a medical basis in the United States, to give out nutrition information. One would wonder, where are these dietitians that are recommending this? Because nowhere in this book do we ever recommend anyone to use a ketogenic diet for the basis of treating disease. In fact, the only time I am aware of that the use of a ketogenic diet is used in all of the medical literature is for the purpose of alleviating some of the effects of epilepsy. So you can kind of at least reduce some of the seizures that someone might get by following a ketogenic diet. So first, the things that I want to look at is, number one, what do dietitians actually recommend for people that have cancer? And then the other one is, what does the medical literature that dietitians are taught in school actually say about the use of vegan and vegetarian diets, and do they apply to cancer? So first, when we are looking at someone who has cancer as a dietitian in the hospital or in the nursing home setting, which is our primary place of employment, those two facilities, is we want to keep them, we want to keep their energy level high. The process that you go through, like you can see if you look at the book here, rather than trying to like copy and paste things or whatever, they go through all these different types of treatments that someone might go through. They mention chemotherapy, they mention radiation therapy, hematopoietic stem cell transplantation, which is kind of a new one, like tissue injections and things like that, or biological therapies, medications that combat anorexia and wasting, and alternative therapies that people can go through. We discuss all of those and the different types of nutritional parameters. So when we prescribe things for dieting for someone who has cancer and someone who is going through those types of treatments, the primary things that we look at are keeping their energy levels high. Now, if you're looking at a ketogenic diet, it does the opposite of that. It's going to make you feel sick to your stomach. You're not going to want to eat. Your caloric intake is likely going to fall, and you're going to experience muscle wasting, which is the primary thing that we want to prevent from having happen in the case of someone with cancer. So that would be the opposite of what you would want. It would be a horrible, stupid idea to try to follow such a dietary program while having cancer. And the fact that Jason, in his little video there, says that is not only incompetent, but I mean, you could really damage someone with that kind of advice and saying that type of thing, which is why I felt like I kind of wanted to do a video talking about the topic. Now, the other thing that I wanted to look at in the book here, this is all from Understanding Normal and Clinical Nutrition, which is, again, a college textbook used. We want to look at like vegan and vegetarian diets. Now, if you go to the Academy of Nutrition and Dietetics and look at their site, you will see when they discuss the topic of vegan and vegetarian diets, they say that not only are they that a carefully planned vegetarian, including full vegetarian or vegan diets, are healthy, but they are also useful in the prevention and treatment of many diseases. Now, that is a statement based on the Academy of Nutrition and Dietetics beliefs, or their statements about certain types of policies on that particular topic. You will not find any such topic or any such statement about ketogenic diets. It does not exist. They have not made one because they do not endorse that type of dieting for the purposes of creating a healthy lifestyle. So when we look at vegetarian diets, they look at several different aspects here. One is weight control. And they say that in general, weight gains are lowest for those eating the fewest animal-derived foods. Vegetarians tend to maintain a lower and healthier body weight than non-vegetarians. Vegetarians' lower body weight correlate with their high intakes of fiber and low intakes of fat because obesity impairs health in a number of ways. This gives vegetarians a health advantage. They go through blood pressure. Vegetarians tend to have lower blood pressure and lower rates of hypertension than non-vegetarians. They talk about heart disease, but what I really wanted to key on here is cancer because that's what the topic of the video is. Vegetarians have a significantly lower rate of cancer than the general population. Go figure. Their low cancer rates may be due to their high intakes of fruits and vegetables. In fact, the ratio of vegetables to meat may be the most relevant dietary factor responsible for cancer prevention. Some scientific findings indicate that vegetarian diets are associated not only with lower cancer mortality in general, but also with lower incidence of cancer at specific sites as well, most notably colon cancer. People with colon cancer seem to eat more meat, more saturated fats, and fewer vegetables than do people without colon cancer. High protein, high fat, low fiber diets create an environment in the colon that promotes the development of cancer in some people. A high meat diet has been associated with cancers of the esophagus, stomach, lungs, and liver, as well as an increased mortality. I really cannot see how it would get much more specific than that. If you are listening to people like Jason Blaha and Furious Pete and anybody else telling you that a high meat diet is good for you, or that in the psychotic example that Jason would say that it is a good idea for you to follow that type of diet if you have cancer, then then you are going contrary to what all professional medical advice gives you. You guys take it easy, and I'll talk to you in the next video.